do hope we can get there, but we're rather crawling. Having said that, there are some issues and concerns that we need to address quickly. Resource utilization. Yes, we do have the money. You might say it's not enough, but the one that we have, what are we doing with it? How are we applying it to people to get healthcare delivery service when they need it? 2, we need to start mapping out, if for example, a particular state at some point of the year, we know it's going to come up with meningitis, for example. We need to have been able to map out and be able to prevent so that it doesn't become an epidemic. There must be strategic investment that will allow for sustainability. We can't do it as a one-off. It has to be a continuum that will grow, and more than anything else, we need to involve the community. The community involvement buy-in is so important for us getting universal health coverage, so that people now see themselves as partakers of this investment. They would want to make it work. Basically, what we're trying to do is to get political will for healthcare delivery service in Nigeria. And oftentimes, you know that when we engage with politicians, especially during the campaign period, they promise us free health for all. And if you ask them, what's free health for all? I mean, what are you thinking of bringing on the table? They say, we'll build hospitals. Health systems is not all about hospitals. It's about getting it right from the primary up until the tertiary. And what are the things that are needed? So we need first to engage. We're hoping part of the outcomes from the first summit is that we need to have closer engagement with the political players themselves, the politicians themselves, the political parties. And moving in from that, we hope to develop like a health manifesto which they can use. And we're hoping that at all levels we'll be able to galvanize people, to galvanize not just the politicians, even the technocrats themselves, to see that health should be given a place of priority in national planning and development. That's what we are doing at UHC 2023. That's part of our mandate, to get Nigerians to understand the importance of health, why they now need to start making demands from the politicians. But so we're going to be doing a lot of sensitization. We want Nigerians to know that health is a right. And we must pursue this agenda. So that's what we intend to do, using the media, using groups, peer groups, using women organizations, even market women, men at the bus station, to make demands. When you talk about health, what are you giving us? When people understand that by right, they can demand for these things. We are engaging with, the youths as vanguards who are going to sensitize people for them to know what to ask. So, and of course, the religious and the traditional institution also, we're going to be engaging with them, so that when these people come to their palaces and promise health, they're going to say, what kind of health are you bringing to us? These are the determinants of good health for us, because they know. So we hope that with the knowledge that we would share, the information that will be shared, with the cooperation of the media like Health Watch is doing and the rest of us are doing, Nigerians will now be able to understand more, to say this is our rights. How do we get it?